Good morning, everyone. I'm Dr. Sakshi, and we are going to discuss today pyrexia of unknown origin. So, what is pyrexia of unknown origin? So, when the fever is more than 101 degree Fahrenheit, remaining for more than 3 weeks, and the patient is not immunocompromised. So, what we have to do, we have to stop the antibiotics or glucocorticoids if the patient is on any. Then we have to look for the drug fever. Like we have to look for the drugs of the patient if any new drugs have been started, and we have to stop it and look for the improvement in the fever of the patient. If so, this is the first step. First of all, we have to rule out the drug fever. Then we have to do the mandatory investigations, which are CBC, KFT, LFT, urine routine, ESR, CRP, CPK, serum LDS, serum protein electrophoresis, then ANA, rheumatoid factor, serum LDH, then chest x-ray, ultrasound abdomen, and tuberculin test. So after doing all these investigations, if some diagnostic clues have been found, which are called as potential diagnostic clues, then we have to proceed accordingly. But if no potential diagnostic clues have been found, in that case, we have to do the cryoglobulin levels of the patient and we have to do the fundoscopy. So this is the second step. So once this is also normal, then we have to proceed to the PET scan of the patient and look for any lesion in the body, and we can do the biopsy of the lesion if any found. After that, if PET CT is also normal, then we have to do the CT chest and abdomen of the patient and temporal artery biopsy if the patient is more than 55 years of age, just to rule out the temporal arteritis. So once all these investigations are also done and no cause has been found still, then what we have to do, we have to review the history of the patient, we have to review the physical examination of the patient and look for the other potential diagnostic clues. But even after doing all these, no cause has been found and the patient is still having fever, what we have to do, we have to follow up the patient if the patient is stable. But if the patient is unstable, in that case, we have to give the treatment trials to the patient. So this is the most simplest way of the approach to a patient of pyrexia of unknown origin. This is from Harrison. Thank you.